Hello everyone, and welcome to the channel. Today we're tackling a vitally important topic, something that can truly make the difference between life and death: the early symptoms of pancreatic cancer. This silent killer is known for its aggressiveness, but the good news is that recognizing its early signs can open the door to effective treatments. Stay tuned, because the information we'll share today could one day save your life or that of a loved one. Pancreatic cancer is one of the most difficult cancers to diagnose in its early stages. Often, symptoms appear only when the disease is already advanced, making treatment options more limited. But we must not give in to this reality. Knowing the warning signs is the first step to successfully fighting this disease. Our goal is to provide you with clear and detailed guidance based on reliable medical information. We want you to be informed and aware, capable of spotting those small warning signs that, if heeded in time, can truly change the course of events. Our goal isn't to create alarmism, but to promote awareness and prevention. Before delving into the symptoms, let's better understand what we're talking about. The pancreas is a gland located deep in the abdomen, behind the stomach. It performs two essential functions: it produces digestive enzymes that help break down food, and hormones like insulin, which regulate blood sugar levels. Its hidden location is one of the reasons why tumors affecting it are difficult to detect. Symptoms tend to appear only when the tumor has grown large enough to compress nearby organs or affect pancreatic function. This is why it's crucial to pay attention to even the most subtle and seemingly harmless signs. The main challenge of pancreatic cancer lies in the nonspecific nature of its initial symptoms. These signs can often be confused with common digestive disorders or other less serious conditions. There is no routine screening test for pancreatic cancer, like mammography for breast cancer or colonoscopy for colon cancer. This means that personal vigilance and awareness of symptoms become incredibly powerful tools. Don't wait until symptoms become severe or unbearable. Learning to recognize the first, subtle changes in your body is the key to timely diagnosis and, consequently, more effective treatment. Now let's get to the heart of the matter. These are the signs everyone should be aware of. Remember, the presence of one or more of these symptoms doesn't automatically mean you have pancreatic cancer, but it does always warrant a medical consultation. This is one of the most common symptoms and often one of the first to appear. The pain may be dull, persistent, and localized in the upper abdomen, sometimes radiating to the back. It may worsen after meals or at night. It's not a sharp, stabbing pain, but rather a constant feeling of discomfort or pressure. If you experience unexplained abdominal or back pain that doesn't improve, it's essential to talk to your doctor. Never underestimate persistent pain. Jaundice is a very important and often more obvious sign. It manifests as yellowing of the skin and sclera, the whites of the eyes. This occurs when the tumor blocks the bile ducts, preventing bile from flowing properly. In addition to yellowing, you may notice darker than usual urine and pale or clay-colored stools. Intense itching is another symptom associated with jaundice, caused by the accumulation of bile salts under the skin. Jaundice is a symptom that requires immediate medical attention. Significant, unintentional weight loss is a warning sign for many types of cancer, including pancreatic cancer. If you're losing weight without changing your diet or exercise routine, pay attention. This weight loss may be due to decreased appetite, nutrient malabsorption, due to a lack of pancreatic enzymes, or the body's increased energy expenditure to fight the disease. Monitor your weight and report any unexplained weight loss to your doctor. Pancreatic cancer can affect digestion in various ways. You may experience nausea, vomiting, a feeling of early satiety even after eating a small amount, or difficulty digesting fatty foods. These symptoms are often related to the tumor compressing the stomach or duodenum. Changes in bowel habits, such as fatty, bulky, and foul-smelling stools, steatorrhea, can also be a sign. This indicates that the pancreas isn't producing enough enzymes to digest fats. Don't ignore persistent or unusual digestive problems. The pancreas is responsible for producing insulin, the hormone that regulates blood sugar. Pancreatic cancer can damage the cells that produce insulin, leading to a new diabetes diagnosis or a sudden worsening of pre-existing diabetes. This symptom is particularly suspicious if it occurs in the absence of other diabetes risk factors, such as obesity or a family history. If you notice excessive thirst, frequent urination, or unexplained fatigue, have your blood sugar levels checked. Feeling constantly tired, even after resting, is a general but significant symptom. Fatigue can be caused by anemia, due to small blood losses or the disease itself, or by the body's inflammatory response to the tumor. This fatigue isn't the usual end-of-day exhaustion, but a feeling of profound exhaustion that interferes with daily activities. If the weakness and fatigue persist without an apparent cause, it's a reason to consult your doctor. As mentioned, itching can be a symptom associated with jaundice. The accumulation of bilirubin and bile salts in the blood can irritate the nerve endings in the skin, causing intense, widespread itching. This symptom, if accompanied by yellowing, is a strong indicator of a biliary or pancreatic problem. It's not a common itch caused by dryness or allergies, but a persistent and often unbearable discomfort. If you notice unexplained itching, especially if accompanied by other symptoms, don't hesitate to seek medical advice. It's crucial not to panic over a single symptom. Many of these signs can be caused by benign conditions. However, the persistence of symptoms, a combination of symptoms, or a progressive worsening of symptoms are valid reasons to see a doctor. Don't try to self-diagnose or minimize your symptoms. Only a healthcare professional can properly assess your situation. Be proactive about your health and don't be afraid to seek a second opinion if you feel unheard. If your doctor suspects a pancreatic problem, he or she will refer you for specific diagnostic tests. These may include blood tests, to check levels of bilirubin, pancreatic enzymes, and tumor markers such as CA19-9, although not specific. Abdominal ultrasound, a first non-invasive test to visualize the pancreas and bile ducts. Computed tomography, CT, or magnetic resonance imaging, MRI, more detailed images to identify masses or abnormalities. Endoscopy, EUS, a more invasive but very precise test, which allows for close-up visualization of the pancreas and the collection of biopsies. Endoscopic retrograde cholangiopancreatography, ERCP, used to visualize and sometimes unblock the bile ducts. Remember, early diagnosis significantly increases the chances of successful treatment. Never postpone a medical checkup if you have any concerns. While there's no guaranteed way to prevent pancreatic cancer, adopting a healthy lifestyle can reduce your risk. This includes: don't smoke. Smoking is one of the major risk factors. Maintain a healthy weight. Obesity is associated with increased risk. Limit alcohol consumption. Alcohol abuse can lead to chronic pancreatitis, a risk factor. Follow a balanced diet, rich in fruits, vegetables, and whole grains. Doing physical activity regularly, it contributes to general well-being. These habits can not only reduce your risk of pancreatic cancer, but improve your overall health and quality of life. We've reached the end of this in-depth analysis. We hope the information shared today has been useful and has raised your awareness. Pancreatic cancer is a challenge, but knowledge is our most powerful weapon. Never underestimate the signals your body sends you. If you found this video helpful, please like, subscribe to the channel, and hit the bell icon so you don't miss our upcoming health content. Share this video with friends and family. You could really make a difference in someone's life. And remember, if you have any questions or persistent symptoms, the first thing to do is always consult your doctor. Your health is your most precious asset.